You asked kind of what's going on with Musk and Trump, and I think that's a really interesting question. I think there's two things going on. So one is I think that fundamentally they are interested in reshaping the United States government, and they are starting in the place that they see as the most vulnerable. When you think about kind of USAID, you started the interview talking about how most people don't necessarily know what USAID is, and that's right, right? Because the beneficiaries are in Africa, Asia, Latin America. They are people living in poverty and in marginalization around the world. And they're not people living in LA or Kansas or Washington, D.C., even, right? And so it's not a kind of well-known entity, and it's not got recipients here in the US. And so I think they see USAID as a test case for what can they do. What if they make the world less capable of responding to public health? And I think there's two reasons they're trying to do that. First off, I think they really saw the failure of the Trump administration during the COVID-19 pandemic as something that they still need to cover for, right? It just, I think it bothered Trump and it bothered so many people that there were public health folks who were actually dared to challenge the president during that pandemic. They saw that as an affront. And so you've seen the hatred that Dr. Fauci has gotten, right? Just for
Oh,
telling the truth about science. And so
yes.
I think this administration has it out for public health in a really damaging way. And you can see this in their appointments, whether it's the HHS secretary and Robert F. Kennedy, whether it's the NIH secretary and Jay Bhattacharya, who's been really kind of the opposite of evidence-based when it comes to these things. These are people who are critics and at times kind of skeptics would be the wrong word. I think conspiracy theorists, unfortunately, is more often the right word. um, and who are people who have been on the fringes of public health and who've actually got it out for public health because where their kind of pet theories haven't been actually evidence-based. So I think you've got that going on where they don't see public health and they don't see internationalism as something that they actually believe in.